basically, to start off with, I wanted to give some background context. So we have very unsustainable trends in terms of transport. And because I'm an academic, I resisted the temptation to cut the y-axis at 250. But hopefully you can see the trend nonetheless, that basically we've got fairly flat motor vehicle miles until about 10 years ago, or maybe a little bit less, when it starts increasing and increases by about 20% over the best part of a decade. And this is a major worry for a whole load of reasons that I'm sure we're familiar with. Even if all these vehicles were electric, I would still be worried, but they're not, of course. Even the new ones are mostly petrol or diesel powered. So we've got a major problem. We want that line to be going down. It's been going up. Secondly, the impacts of this problem are shared unequally. And again, I could talk about this a lot. I just wanted to pull out a couple of examples. But the point is that groups that are least likely to use motor vehicles are most likely to be harmed by them. This is a social justice issue. So to give you one example, disabled Londoners and those with health conditions make around a third fewer car trips each day than non-disabled Londoners. But as pedestrians, disabled pedestrians are 5 times more likely to be injured by a motor vehicle than non-disabled pedestrians. So, you know, the disparity between the access and the risk is hugely unequal. Similarly with non-car owners. So non-car owners are around 3 times more likely to be injured by a motor vehicle as pedestrians than people who in households that own 2 or more cars. So, this is the case for a range of different demographic groups. This is the case for a range of negative impacts. Within London in particular, and I think also within some other urban areas, we've also seen a very worrying trend in the past 10 years, which is not just that growth in motor traffic has started again more generally, but there's an increased burden, particularly on minor roads, particularly on residential roads. So this graph is taking into account the Department for Transport's recalculation of minor road traffic based on its 10-year programme of counts. And what they found when they did this recalculation recently was that they thought that minor road traffic had been in London had been going up somewhat, but they found that it had actually been going up a whole lot more than they thought, and it's nearly doubled in 10 years. Now, what's happening there is that minor road traffic is becoming less predictable than it was, because what was happening was that the count sites that they'd used to predict minor road traffic were no longer predicting growth in minor road traffic. And I think that indicates that a lot of this is due to the increased use of in-car navigation, which has basically opened up a whole load more minor urban streets to through motor traffic, with the result that, as the London Assembly has commented in their London Stalling report, London's road network is increasingly hosting more traffic than it has the capacity to cope with. And this has not just been the case in London, but also in other urban areas. So we have a problem, or we have a range of problems. And low traffic neighbourhoods are one way in which some of these problems are being addressed. Obviously, there are a whole range of policies that are needed, but I'm just focusing on this particular one. So low traffic neighbourhoods, what are they? Well, I expect most people know, but in case you don't, they use modal filters. Basically, this can be bollards or planters, as in this example. It can be cameras, bus gates and so on, to restrict through motor traffic in residential streets. So just having looked at the chat, one interesting point in relation to this is that these are not fully pedestrianised streets. Drivers have access to all addresses, but you cannot drive through them to cut through to somewhere else. It's standard practice in the Netherlands as part of standard transport planning. It's actually called unbundling. And the idea is that your residential neighbourhoods, your residential streets, are not used as conduits for through motor traffic. They are prioritised for walking, cycling, play, recreation and so on. And some interesting links with the thinking about open space and accessibility of open space, particularly for those without private gardens and so on. This approach is increasingly popular in other European countries and North America. So Barcelona has introduced superblocks, New York has introduced open streets and so on. But it's often, as people may be aware, very controversial in contexts where it's not the tradition. And so the Dutch just do it, but for the rest of us, it's really quite hard. So I've been studying this, and one of the projects that we've been working on has been mapping new low traffic neighbourhoods in London. So one of the drivers for introducing low traffic neighbourhoods at the moment obviously is around COVID, and is around providing, enabling people to have access to streets that maybe they wouldn't be able to access because of the amount of motor traffic, being able to use more of the carriageway as well as the footway to walk, jog and cycle and so on. And so this map shows you basically specifically low traffic neighbourhoods in London that were implemented between March and September 2020, so over a 6-month period. And it's quite substantial. These new low traffic neighbourhoods covered 4% of London residents, we calculated. So that's around 300,000 people, and that's over this 6-month period. It's very unequal across different boroughs though. So in Hackney, the figure is as high as 1 in 6, 17%. But of London's 33 districts, only 2/3 have built low traffic neighbourhoods during this period, and with widely varying coverage. 10 built no low traffic neighbourhoods and 2 built low traffic neighbourhoods but removed them soon after. So a couple of other facts that I think are quite interesting. So when we looked at the distribution of these neighbourhoods, we've got a paper coming out that does more detailed analysis. But just to let you know, we found that across London, people in the most deprived quarter of neighbourhoods are almost 3 times as likely to live in a new LTN compared to Londoners in the least deprived quarter. So across London, they're concentrated more in deprived areas. And that is partly a function of the fact that places like Hackney have introduced them and places like Bromley have not. But it's also, we found that boroughs that have put them in have tended to put them in more in deprived areas than less deprived areas. Also, the potential reach of low traffic neighbourhoods, if they're found to be a good intervention, is quite large. So across a range of demographic groups, around 9 in 10 Londoners live on residential streets rather than main roads or high streets. And I found that quite interesting. I wasn't perhaps expecting it to be that high, but it is. And it's similar across income groups, for instance. What I wanted to focus on, though, in the rest of this presentation is some research we've done looking at low traffic neighbourhoods in Waltham Forest, which I think potentially provides some useful evidence for policy. Obviously, it's limited. It's only one London borough, but we've basically been doing a longitudinal study, a longitudinal survey, looking at Outer London's mini Hollands. And one of those boroughs, Waltham Forest, had actually introduced low traffic neighbourhoods between 2015 and 2019. So this was quite good, because it meant that we could use our survey data to look at the LTNs. And then we thought, well, why stop there? Why not use a whole range of administrative data that we can't yet use for the new LTNs, because they're too new, to look at what happened in Waltham Forest? And so we started scouring all the administrative data we could find to try and look at the impacts and see if we could find impacts of these measures. So potentially this provides some insights into the kind of results that we might expect from the new LTNs, although I think a lot more research will be needed as this becomes possible. Just also to say, the results I'm going to just quickly run through in the rest of the presentation, all of them are compared to control areas. So all of them are looking at change where low traffic neighbourhoods has been introduced compared to change in other areas. And this is really important in terms of attributing causality, and it's going to be really important for the current crop of LTNs, because as we all know, travel behaviour at the moment is going all over the place. So what did we find when we looked at the impact? Oh, this is just a map to show you where some of these LTNs have gone in the areas shaded in blue within the borough of Waltham Forest. So firstly, active travel. And I don't know if the slides are going to be shared afterwards, but anyway, I've got links to these papers. Yes, good, where you can read more. And I'm also very happy if people want to contact me. So our first finding comes from our longitudinal study that we were in any case conducting across Outer London. And when we looked specifically at low traffic neighbourhoods in Waltham Forest, we found a really substantial impact on active travel. So we'd found anyway that walking and cycling interventions led to more walking and cycling. But when we looked at the low traffic neighbourhoods, the effects were much larger, although with large confidence intervals because the numbers were relatively small. But we were finding that the point estimates were saying that after 3 years, people who lived in an LTN that had been introduced in Waltham Forest were doing nearly 2 hours more walking a week and 20 minutes more cycling. So really substantial increase. And for me, the increase in walking has been particularly notable, because I guess I thought that maybe there wasn't that scope for that much extra walking, but it seems like there is. And that has links to, discussions of the 20-minute, 15-minute, 5-minute, or whatever you want to call it, neighbourhood, the fact that people did do this quite a lot more local walking. But perhaps even more exciting, well, it depends what you get excited by, but is the fact that we found a decrease in car ownership. Now, this in a sense is kind of a holy well, because there's a lot of, if you're familiar with the research around active travel interventions, then increasingly we're getting good evidence about increased active travel related to interventions, but finding a change in car use and car ownership is always quite challenging. It's easier to get more walking, more cycling than to get less car ownership, less car use. So in terms of these LTNs, we use DVLA vehicle registration data. So we used a method, comparing, as I was saying, comparing the intervention areas, the LTN areas with control areas and doing a comparison of the changes. And we found that the number of cars or vans registered in the low traffic neighbourhoods dropped 6% after 2 years. And we also found a change in areas in Waltham Forest with other walking or cycling schemes, which is also good, 2% fall, but 6% fall. And, people often find it hard to interpret this level of change. But so I had a look at the literature and I found that there's a similar level effect from there's a typo there, from very, stringent financial deterrents to car ownership in Amsterdam. So in Amsterdam, I don't know if people know, but if you want a car parking space as a resident, you have to sit on a waiting list for ages and you have to pay market rent for car parking in the meantime. So it's quite, it's quite stringent, quite challenging, and it leads to a similar impact on car ownership compared to the impact of living in an LTN. So that's interesting. Another finding was around road safety. So once you get started with administrative data sets, it's really hard to stop. So we looked at the impact on Stats 19, police recorded injuries, and we found a very large reduction in road traffic injury risk on roads within the low traffic neighbourhoods. So this is both a reduction in injury numbers, but also we were able to look at this data in relation to our data on the change in walking, cycling and car use. So when you think about the fact that not only are injuries to pedestrians and cyclists going down, but the amount of walking and cycling is going up, this is really quite substantial. And if we're talking about a 70% reduction in injury risk, to give you a comparison, a study looking at the impact of 20-mile-an-hour zones in London found a reduction of around 20%. So this is substantial stuff, and you can see in the chart there the outer London numbers are going up, and the numbers inside the LTN are going down. So yeah, there's a safety benefit, and this is a safety benefit for all modes as well, pedestrians, cyclists and car users. We didn't find any negative impact on boundary roads either, so it wasn't like casualties were being displaced. Street crime, we also looked at street crime. So we found a 10% reduction in street crime inside the low traffic neighbourhoods, and the decreases were larger for violent crime. The increase, this increased over time as well. And again, we didn't find any displacement to adjacent areas. So this was interesting because actually there's a lot of discussion about the impact of modal filtering of LTNs on crime. And when we went to the crime literature, because we were not crime researchers, we started looking at the crime literature, we found that actually the crime literature suggested that there might well be a reduction, because if you get more pedestrians, you get more eyes on the street, you get potentially greater sense of ownership, you get with less through traffic and so on. So actually the crime literature suggested that we might find a fall, but we didn't really know what we would find. So that's what we found. And just to let you know, there's only one, the stars are the statistically significant changes. There's only one type of crime that went up, and that was bicycle theft, which almost doubled compared to the control area. Everything else declined, or there was in a couple of cases, there was no statistically significant difference. So bicycle theft, and that, obviously it's not nice for anybody who has their bike stolen, but it's kind of nice in that it confirms the finding that we think there's more cycling, and which would naturally be associated with more bicycle theft, all else being equal. So that's another finding. And yeah, just to summarise, the LTNs in Waltham Forest seem to have led to more active travel. They seem to have led to reduced car ownership. They seem to be safer for all modes, walking, cycling and driving, without any problematic boundary impacts. And they've led to a reduction in street crime, with the exception of bicycle theft, again with no boundary impacts. It didn't seem like the crime was just being moved somewhere else. And I thought I wouldn't have time to talk about the last one. So I've just put it as a bullet point. So we found no impact on emergency response times when we used fire brigade data. We actually found a slight improvement at the boundary roads, which was surprising, but obviously welcome. But one interesting thing to point out before I finish is that the fire brigade data, we didn't find any negative impact, but what we did find was that fire crews were more likely to record a traffic management related delay initially. So what that was telling us was that there wasn't an increase in delay, but there was potentially an increased perception of delay. And I think this is something really important to remember with LTNs and other, potentially controversial interventions, is that, if something is salient, then it's very easy to attribute delay, which is quite a common feature of travelling around London by various modes, to that intervention if it's salient, as opposed to it, just if it's just seen as something that just happens. So this is another reason for me why it's really important to do controlled research where we can actually attribute impacts of any changes to a specific intervention. I'm really hoping we're going to be able to do something similar for the current and recent crop of LTNs. So, just to finish, could these findings be replicated across London? So for the 4% already covered by September 2020, but also if up to 90% of residential addresses might potentially be covered by LTNs, people who live on residential streets, could we really see all these benefits? And I think, obviously there's a whole range of interventions that are needed, but it seems to me like LTNs could play quite an important role in this for all the reasons that I've just outlined. So yeah, I'll finish there. Thank you.
Thanks, Rachel. Compelling research as ever.